All right, Joe. So I'm gonna go get your warfarin uh today. So I'll be right back with that med. Are you in a good, comfortable position?
Yeah, thank you.
Okay. All right. So my four nursing considerations for this drug for warfarin would be I would monitor blood studies, I would monitor bleeding. I have already taken Joe Smith's blood pressure today. That was all within normal range, so I'm good to go for today, and I will continue to monitor it throughout the day as the days go, as long as he's still getting warfarin. I took Joe Smith's temperature today. He did not have a fever. Once again, I will continue to monitor that and take his temperature as long as he's still on this drug. Warfarin is a high alert drug, so I will have to have a second nurse check my work and look over my stuff just to make sure everything's good to go since it's a high alert. So, one lab for this drug is an INR. So Joe Smith's INR levels were at a 2.7. The therapeutic range is between a 2 and a 3. So that is why I'm good to go with giving warfarin today. So now I'm going to just I have gathered and cleansed my supplies here. So I'm going to just look at my MAR and my provider orders. So I'm going to just go ahead, look at these, and make sure I have the correct patient. So I have Joe Smith, date of birth 10/5 of 54. So I have Joe Smith, 10/5 of 54. And then shows here I need to give warfarin 5 milligrams. So warfarin 5 milligrams. And I'm giving this by mouth once a day, by mouth daily. And this is for AFib and AFib right there. So Joe Smith has not received this medication today, so I'm good to give it for that reason. I'm going to put my provider orders away because I will not need to use those anymore. And then I'm going to just go ahead and get my med out of my med cart. So I grabbed my warfarin here. So I'm just going to go ahead and make sure I have the correct patient. So I have Joe Smith, date of birth 10/5 of 54. And I have warfarin here, warfarin. This is a 5 milligram tablet, and the order is 5 milligrams. I'm giving this by mouth once a day for his AFib. So that all looks good. The expiration date on the packaging is 4/4 of 2041. So the expiration date is good. The integrity of my packaging is still good. And I am going to go ahead and put this unopened into my med cup. And once again, the med has not been given yet. So I'm going to go over here to do my second check. So I'm going to just look that I have Joe Smith, date of birth 10/5 of 54. I have warfarin. The dose is 5 milligrams. So I got 5 milligram tablet right here. I'm giving this once a day by mouth for his AFib. So that looks good. My expiration is 4/4 of 41, and the integrity of my packaging is good. So this is a 5 milligram tablet. The order states I need 5 milligrams a day, so I won't have to break or crush the tablet in any way. So I'm going to put my med unopened back into my med cup, and the med has not been given yet. So I am now going to do my third check at bedside. Hi, I'm Jenna. I'll be your nursing student today. Can you just state your name and your date of birth?
Joe Smith, 10-5-54.
All right, I'm gonna just check your wristband, verify that looks good. And then do you have any allergies I should know about?
Sulfa and betadine.
Okay. I'm going to just check my provider orders here. It looks like the provider ordered some warfarin today, so that is what we are gonna go ahead and give. So I am gonna put gloves on for this to administer the drug. So I got my gloves here and I'm gonna provide for privacy. So I'm gonna shut my curtain. And then are you all good with getting the warfarin today?
Yes, ma'am.
All right, I'm gonna have you just get in a comfortable position. So I'm gonna have you just sit up here. Are you okay swallowing pills?
Yeah.
Okay, and how would you prefer to take them?
Well,
Okay, I have that. I'm gonna go ahead and scan your wristband. Beep. All right. So now I'm just gonna go through and double check my MAR. So I have Joe Smith, date of birth 10-5-54. I have my warfarin, my 5 milligrams. I'm giving this by mouth once a day for his AFib. I'm gonna go ahead and open up my med. So Joe, today you're gonna be getting this warfarin. This is a blood thinner. So this is just gonna thin out your blood for your AFib. It's gonna just help the heart be able to pump really good. So I'm gonna open up my med. I'm gonna just note that my expiration date is good. The integrity of my packaging is also good still. So I'm gonna open this up. My med in my med cup. I'm gonna go ahead and scan my packaging. Beep. All right. So the action of this drug would, it interferes with blood clotting by indirect means. Some side effects of this drug, Joe, are going to be hemorrhage, rash, or purple toe syndrome. So purple toe syndrome is for getting, when you get too much warfarin, that will cause you to get little blood clots in your vessels, which could turn your purple or your toes purple. So we'll just keep an eye on that and make sure that that doesn't happen to you today. I also just want to note that we're going to just be very on the cautious side with your bleeding. So we're going to make sure you're using a soft bristle toothbrush, an electric razor, nothing that's going to cause you to possibly bleed. So I'm going to go ahead and just scan your wristband. Maybe again, beep. Just make sure we have the correct patient. All right. And then do you have any concerns before you get this med today? Okay. Can you just go ahead and teach back to me what you know about this med so I know you understand?
getting warfarin or blood thinning agent. Purple toe syndrome. Might bleed a little bit and have a rash.
All right. So here's your drug. And then once again, that's warfarin that you're getting, 5 milligram tablet. All right. So I'm just going to stand by and make sure Joe Smith swallowed the pill. It's completely gone and we're good to go before I leave. Just going to throw my gloves away there. So there were some drugs that you could have gotten today. You had PRN pain meds, which you didn't seem to be in any pain, so you haven't taken those at all in the past, so we held on those. The digoxin, we did not get that because your potassium level was a little bit low. The digoxin could make that level become even lower, which would make your heart have to work even harder, and we wouldn't want that to happen. The Lasix, we did not give that today either because of your electrolyte levels. They were a little bit low, and that's a diuretic, so that would make you lose those even more, and we wouldn't want that. So I'm just going to notify the provider of that, and he will let you know what he would like you to do for your potassium levels being low, whether he needs to give you a vitamin or some potassium rich foods. We'll leave that up to him. So I'm going to go ahead and document that you got this med. So I'm just going to put on here that you got this med at 2:30. So I'm just going to write that, and then I'm also going to document the meds that we withheld today. All right, Joe. So I'm going to come back in about 30 minutes, and we're just going to make sure you're not having any adverse side effects to this drug. If you were, we would hold the next dose. We would check your vital signs. I would notify the provider, I would notify the pharmacist, and I would document. If there were anything abnormal, I would document per agency policy. But other than that, thank you for your time. Do you need me for anything else before I head out of the room?
So,
All right. So I'm just going to put your call light near here. I'm going to put your bed low and locked. I'm going to put your side rails up, your bedside table within reach. I'm going to scan the room for any risk of falls. I'm going to clean up my area here. I'm going to cleanse my supplies. Pick this up. I'm going to do my hand hygiene after cleaning and cleansing my equipment. The 5 moments of hand hygiene are before touching a patient, before touching a patient's things, after touching a patient, after touching a patient's things, and after coming in contact with bodily fluids. I might have messed that up. Before touching a patient, before doing a procedure, after touching a patient, after touching a patient's things, and then after coming in contact with bodily fluids. So I'm going to go ahead and finish up my documentation. I'm going to fill out my OneNote and submit that. I'm going to submit this video. I am going to upload my note cards that I used and my filled out MAR documentation. So thank you, Joe. I'm going to head out today.
yeah.